As we move through 2024, the U.S. healthcare system is undergoing several key changes that could impact our health, wallets, and access to care. From addressing high prescription prices to increasing support for preventive health, these shifts aim to improve the system for millions of Americans. Here's a countdown from number 10 to the most significant healthcare change happening today. 10. Prescription drug prices are getting squeezed finally. In recent years, skyrocketing prescription drug prices have led many to question if they should prioritize essential medications or basic living expenses. Fortunately, the Inflation Reduction Act is helping to tackle this issue by setting price caps on certain medications. Beginning in 2025, Medicare Part D enrollees will see an annual out-of-pocket maximum of $2,000. This cap will apply to various essential medications, including insulin and certain cancer treatments. While this policy targets Medicare recipients, it sets a precedent, encouraging future regulations to help Americans with private insurance as well. This move signals a crucial change, helping individuals and families save potentially thousands of dollars annually on life-saving medications. 9. Mental health services, more accessible and less stigmatized. Mental health care has finally started receiving the attention and funding it deserves. The federal government has increased resources for mental health services, especially for adolescents and underserved communities, helping to make therapy more accessible. Adding to this, the 988 Mental Health Crisis Hotline has launched as an easy-to-remember emergency number for anyone experiencing a mental health crisis. With mental health issues on the rise since the pandemic, this focus on accessible care couldn't come at a better time. The 988 hotline alone has already helped millions in critical situations, a clear indicator of the country's growing dedication to mental health. Thanks to this increased funding, getting help is becoming more affordable, destigmatized, and readily available to those in need. 8. Telehealth is here to stay, thank you technology. Telehealth, a healthcare option that allows patients to visit their doctors via phone or video, surged nearly 10,000% in usage during the COVID-19 pandemic. The convenience of talking to a doctor without leaving home appealed to millions, and policies are evolving to maintain insurance coverage for telehealth services. Medicare has extended coverage for these virtual visits until at least 2025, and private insurers are likely to keep following suit. For individuals in rural or underserved areas, telehealth bridges a critical gap in healthcare access, making it easier to consult with specialists or follow up on conditions without a long drive. Whether it's a simple checkup or a mental health consultation, telehealth's continued expansion marks a significant improvement in accessibility. 7. Few things are more frustrating than receiving a surprise medical bill for hundreds or even thousands of dollars after a hospital visit. The No Surprises Act, effective as of January 2022, aims to prevent such financial shocks. Under this new law, patients can't be hit with unexpected bills for out-of-network emergency services or routine hospital visits when they didn't knowingly choose an out-of-network provider. This policy is already saving countless Americans from unpleasant post-visit surprises. While patients are still advised to verify network providers for non-emergency visits, the Act significantly reduces costs for emergency and unavoidable out-of-network care. 6. Medicare Advantage plans have grown more popular, with over 28 million enrollees as of 2024. To keep their edge in the competitive insurance market, these plans have started offering a variety of new perks, such as fitness memberships, meal delivery services, and even over-the-counter allowances for personal care items. These value-added benefits not only make seniors' lives easier, but also promote overall wellness. For example, plans that cover transportation to medical appointments help ensure people attend critical checkups. Medicare Advantage's added benefits encourage healthier lifestyles and reduce the barriers to accessing routine health services. 5. If you're the type to budget your health expenses carefully, HSAs, health savings accounts, just got more attractive. The 2024 HSA contribution limits have increased to $4,150 for individuals and $8,300 for families. Some lawmakers are even pushing to expand these limits further and reduce restrictions on what can be purchased with HSA funds. HSAs are tax-advantaged, meaning the money you save in them is tax-free and can grow over time. With higher contribution limits, people can save more for future health expenses. This expansion allows individuals, especially those with high deductible health plans, to save more on a tax-free basis, creating a financial safety net for future healthcare costs. 4. Medicaid is expanding its reach, with new states such as North Carolina opting into the Affordable Care Act's Medicaid expansion. This shift means that more low-income individuals are now eligible for affordable health insurance. With 40 states now on board, Medicaid is making healthcare accessible to more people than ever before. Medicaid expansion helps bridge the healthcare gap for millions who previously couldn't afford coverage. These changes are expected to lower health disparities and offer preventative and routine care to those who need it most. Medicaid expansion is a significant step toward more equitable healthcare access across the U.S. 3. Focus on preventive care and wellness programs. Thanks to the Affordable Care Act, most insurance plans are now required to cover preventive services like vaccinations, cancer screenings, and annual wellness visits at no extra cost. Additionally, wellness programs are becoming more common, incentivized by both Medicare and private insurers to encourage healthier lifestyles and prevent chronic conditions. Preventive care helps identify and treat health issues early on, improving outcomes and reducing overall healthcare costs. For individuals, these programs make it easier and cheaper to stay on top of their health before issues spiral into more severe and costly conditions. 2. Medicare to cover more at-home care services. With the U.S. population aging, Medicare is stepping up by covering more at-home healthcare services. Now, seniors can receive care like physical therapy, medication management, and personal care aid services right in their homes. Medicare Advantage plans have expanded these benefits to meet the needs of a growing senior population, many of whom prefer to age in place rather than enter institutionalized care. This expansion of coverage not only aligns with the preferences of many seniors, but can also be more cost-effective than traditional long-term care facilities. At-home care services are designed to keep seniors comfortable and independent for as long as possible. 1. Affordable Care Act, ACA. Subsidies are expanding. Yep, more discounts. For millions of Americans, health insurance has become more affordable thanks to the Affordable Care Act, ACA. Enhanced ACA subsidies, originally introduced during the pandemic, have been extended through 2025. These subsidies allow lower and middle-income families to save significantly on their health insurance premiums. Many individuals who qualify can now pay as little as $10 per month for comprehensive coverage depending on income. The ACA subsidies extension has made coverage possible for millions of people who might otherwise go without insurance. As healthcare costs remain high, these subsidies provide a crucial lifeline, making it possible for more people to get the care they need without facing financial hardship. These changes may not solve every healthcare challenge overnight, but they're important steps toward a healthier, more affordable, and accessible healthcare system. Whether it's expanded Medicaid, reduced drug costs, or telehealth access, each change represents progress that's helping more Americans receive the care they need when they need it, and that's something worth knowing about. If you found this video helpful, make sure to subscribe to our channel, like this video, and share it with your friends and family. Together, we can spread the word and make a difference in healthcare.